Hello, my name is Dr. Elliot herein. I'm a board-certified chiropractic neurologist at New Life Functional Neurology and Endocrinology in Greenville, South Carolina. I help patients with chronic health conditions like thyroid disease. Do you have symptoms like insomnia and fatigue? You can't fall asleep, you can't stay asleep, so you wake up and you toss and you turn. You can't fall back to sleep. Then you get out of bed in the morning and you feel more exhausted than you did the previous night. Do you have cold hands and feet? So cold you drive your spouse nuts because you're always fighting over the thermostat, only to give up and start wearing socks and maybe even gloves to go to bed? Are you unable to lose weight despite diet and exercise? Do you have cramping or bloating, especially after you eat certain types of foods? Do you experience depression or anxiety? Has your motivation level just plummeted? You just don't feel like doing even the fun things you used to do? Is your hair thinning? Are you seeing huge clumps in the shower drain? Is your skin dry and flaky? Do you have brain fog? That's where you just walk into a room and you forget why you're there. Do you have short-term memory issues? If your answers to these questions is yes, then you probably have thyroid disease. I want to give you some encouragement. First of all, you are not alone. And second of all, there is hope. I see cases like this in my office every single day, and with the tools I'm going to talk to you about today, we get phenomenal results in helping patients just like yourself to literally get their lives back. One of the biggest complaints I hear from patients, aside from the symptoms I just mentioned, is that their lab tests are normal and their doctor said there's nothing more that can be done for them. People like yourself are really frustrated because you've been asking a lot of great questions about what's causing your symptoms, but you've gotten very poor answers. In fact, some doctors may even have brushed you aside saying that you must be depressed or that you're crazy. Again, if this is you, there is hope. Have you, out of sheer frustration and determination, tried to get some additional testing on your own? Have you even tried to treat yourself? Maybe you've changed your diet. Maybe you've exercised more. Maybe you've even taken some supplements that you found on the internet to be helpful for thyroid symptoms. Despite all of your best efforts, you're still unable to get a handle on the symptoms that are creating a huge impact on your quality of life. You're probably very unmotivated to do even the things that you used to be the most exciting for you. Going out with family and friends, attending church functions, playing golf, traveling with your grandkids. What are you missing out on in life because of your condition? If you think about it, your life has probably changed dramatically since you started having symptoms of thyroid disease. Just like most patients I see in my office, you'd probably say to me, "I just want to be my old self again." If that's you, I can help you. If you're like most patients I see, in your quest to determine why you feel the way you do, you've probably gone from one doctor to the next, searching for answers. In each of these visits, the doctor probably only spent a few minutes with you and probably just give you a different spin on the same story. Your tests are normal, there's nothing I can do. There's two main problems that make this situation all too common. Number one, the TSH, or the thyroid stimulating hormone, the so-called gold standard in medicine to assess for thyroid function, is very incomplete as a standalone test. There are 9 other markers just on blood work that can and should be run to test for thyroid issues. In the medical model, however, they are rarely run. I always order all 10 right from the start. Number two, the laboratory reference ranges used to interpret the lab values for TSH and the other markers are too broad and imprecise. The ranges are really broad and they don't allow your doctor to pick up on any potential warning signs that a disease is actually in progress. The goal of modern medicine is basically to keep you alive, so they create these reference ranges that's so wide so that it rules out serious life-threatening pathologies, and that's good. But I use functional ranges that are more narrow, specific, and precise and allow me the opportunity to give you as my patient a better understanding of any physiological dysfunction and how it's contributing to your symptoms, rather than just waiting until your numbers are so far along that you actually qualify for a medical diagnosis. This is basically why your labs keep looking normal even though you feel quite the opposite. The medical standard of care for thyroid disease is really stuck in an outdated model. The goal for thyroid care is merely to keep your TSH levels in between these arbitrary lab values regardless of whether or not you still have symptoms. In this approach, the actual underlying physiological causes of your thyroid dysfunction are never actually identified, so they can never be properly addressed. When you do not address the root causes, you'll never get improvement on your symptoms nor your quality of life. I like to represent this antiquated model of thyroid disease in the medical realm with a box. Inside this box is all that the medical community has to offer thyroid patients. They test the TSH, they keep it inside the range with medications, and that's it. They're done. There's no regard for causation of what's actually going on. The parameters of this standard of care for thyroid are determined by two entities, the pharmaceutical companies and the insurance companies. The drug companies decide what therapies are available, and the insurance companies determine what they're going to pay for. If we want to get real answers and real solutions to your problems, then it's critical that we step outside of this medical box. When we do this, because insurance companies are part of that box, oftentimes insurance does not cover the cost of our services, even though we get phenomenal results. We do, however, have a variety of payment options that can work with most budgets. In order to understand what I do in my office that changes lives of so many thyroid patients, we first need to understand what the thyroid gland does and how it works. In a nutshell, the thyroid gland drives your metabolism. It's what allows your hair cells to grow, your stomach cells to digest and absorb food, your brain cells to communicate with each other and create thoughts and actions. If you have low thyroid hormone, the metabolism of all these cells goes way down, and you end up having symptoms in each of these systems. So, for example, your hair falls out, or you have cramping and bloating or gut-induced autoimmune thyroid disease, or you have brain fog and memory issues. Let's briefly review how the thyroid works. It all starts in your brain, and there's two parts of your brain that contribute to telling the thyroid when to make hormone. The first one is your hypothalamus. The hypothalamus sends a signal to the pituitary gland. That signal is called thyrotropin-releasing hormone, or TRH. Let's just say there's three messengers, Tom, Renee, and Harry. They go down, knock on the door of the pituitary gland. The pituitary says, "Hey, what do you want?" And the pituitary sends a signal down to the thyroid in the form of TSH, or thyroid stimulating hormone. And that tells the thyroid that you need to make more hormone. In order to make more hormone, we have to have a couple of things. You have to have raw materials, you have to have the machinery to do it, and the machinery in this case is called TPO, or thyroid peroxidase enzyme. So that TPO, the enzyme, puts together the raw materials. The raw materials are TG, or thyroglobulin, tyrosine, and iodine. When we put all these things together with TPO and we put 4 iodines, we're going to get T4. If we put 3 iodines, we get T3. Now T3 is the most important one. That's the one that actually does all of the work in driving the metabolism of the cells that I talked about before. T4, although it's very important for other things like gut function, it does not really drive metabolism of all of your cells. And so we need lots of T3, but the problem is 93% of all of what is produced by the thyroid is actually T4. Only 7% is T3. So now we have to convert T4 into T3, and that actually happens in another part of your body. Now that T4 has to go to these other parts of your body, and in order to do that, it has to get on a carrier protein. We call this carrier protein TBG, or thyroid binding globulin. Think of it like a bus. The bus has a bunch of seats. T4 and T3 get on the bus, and it will take it where it wants to go. In this case, we want it to go to the liver. That's the first place that the conversion of T4 to T3 happens, is in the liver. When we get to the liver, the T4 jumps off the bus. 60% of all of the T4 will get converted directly into T3 if the liver is functioning well. 20% gets converted into something called reverse T3. Reverse T3 is completely inactive. It does nothing to drive metabolism of the cell, but it can be used as a good marker to identify whether this conversion process is happening properly. And then the other 20% gets converted into something called T3S and T3AC. T3 sulfate and T3 acetic acid, they are temporarily inactive until we go to the gut. And inside the gut is where we have the rest of the conversion from T3S and T3AC over into T3. Now we've got all these different places that are making T3. We've got the thyroid produced a little bit, then we had a little bit more in the gut, and then we've got most of it in the liver. Now all these things have to be functioning properly in order for this to happen. So a lot of people think, well, it's always a problem with my thyroid, but you see there's so many other systems involved now that if they are dysfunctional, they can produce hypothyroid-like symptoms. So we got all this T3 now, it's going to go to your cells to activate metabolism. At the cellular level, when the T3 binds with the cell in a cellular receptor, it's going to activate a whole bunch of chemical signals and messages and reactions in the cell that's going to go down to the DNA level of that cell, and it's actually going to drive the metabolism of the cell. So as in my previous example, it's going to make your hair grow, it's going to make your stomach digest and absorb, it's going to make your brain fire. That's what's going to happen when T3 activates the cell. So if you don't have T3, then that becomes a problem. So all of that is how the thyroid gland works normally. The question becomes, what happens when things start to go wrong along the way? Let's talk about some of the over 20 dysfunctional patterns that can actually cause thyroid disease. So we went through that whole list of how things happen normally. If anything goes wrong in any of those particular patterns, we can have dysfunction that can lead to low thyroid symptoms. So let's start back up in the brain. The brain, where we signal the hypothalamus to the pituitary down to the thyroid, that signaling can be messed up if you have low neurotransmitters, two of which are called serotonin and dopamine. They're also your happy hormones, so if you don't have enough of them, it can also be associated with mood issues as well, anxiety, depression. If you have high levels of cortisol from chronic stress, whether it's mental emotional stress or physiological stress, that can lower this process, as can chronic inflammation. Chronic inflammation can be due to blood sugar issues. It's also a driver of all chronic diseases, so we see a lot of high inflammation in many people. The next step is where we had the TPO activity. So that's the thyroid peroxidase enzyme that was actually creating the thyroid itself, the thyroid hormone. The activity of that can drop off, which would mean that there's less hormone being made. That can drop off if we have a deficiency of cofactors, things like the actual building blocks of thyroid hormone, iodine, tyrosine, but also some other cofactors like selenium and copper and magnesium, zinc, and B vitamins. That can all slow down the actual creation of thyroid hormone itself. The next one is an autoimmunity to your thyroid. This is where your immune system goes haywire, it gets confused and disorganized, and it starts to actually destroy your own tissues. You probably know that your immune system is supposed to defend you from the bad guys, bacteria, viruses, parasites. But in an autoimmune situation, what happens is now your immune system is actually attacking your own tissue, in this case the thyroid. In particular, it attacks the enzyme, the machine that actually builds the molecules. It also attacks thyroglobulin, the backbone to those molecules. So think about it this way. The thyroid's just a factory, it just makes hormone. And if we were talking about a car assembly plant and we went in and we destroyed all the machines and all the raw materials, do you think that that plant is going to make very good cars the next day? No, it's not. And that's what's happening with the thyroid. It's just being destroyed. If the immune system would leave the thyroid gland alone, the thyroid would be like, hey, I can make thyroid just fine, but the immune system is in there beating it up, and it's a big problem. The next place we can have dysfunction in the thyroid metabolism is where we're actually converting the T4 over into the T3. This is a very important process, remember, because we have to have T3, not so much of the T4. A couple of different things can slow down this process, whether it's in the liver or in the gut. Those same deficiency of cofactors that I talked about before, we need those cofactors for this process as well. So zinc, selenium, magnesium, those types of things. If we're low on those, then that can cause problems. Either you're not getting enough in your diet or you're eating it, but you're not digesting and absorbing properly those cofactors. You could also have low dopamine and serotonin, high cortisol and inflammation. That's the same as the brain patterns that we just talked about. Over in the gut, where we also have a lot of conversion of T4 to T3, there's things that can go wrong there as well. You can have gut dysbiosis. And what this means is that when you think about the bacteria in your gut, you're supposed to have a whole lot of good bacteria, not really any bad bacteria. When this becomes unbalanced and you have some bad bacteria and not so much good bacteria, we call this a dysbiosis. It could be an outright infection with a parasite or something like that. We also have to deal with food sensitivities. Food sensitivities is where when you eat a particular food, it causes an autoimmune inflammatory response in your system that can drive autoimmunity, in particular autoimmune thyroid, the pattern that we talked about before. And if you have a food sensitivity and you continue to eat those foods, then that's going to continue to drive the Hashimoto's, which is the autoimmune disease for thyroid. And it really is the most common cause of hypothyroidism in the United States, the autoimmune component. So food and gut function becomes really important when we're talking about overall thyroid health. And so it's really important to keep that in mind. And then the third thing in regard to gut function is something called leaky gut. Leaky gut is where the barrier of your intestine that is supposed to block things from getting into your bloodstream, things like bad guys, of course, but also food particles before they're digested, that barrier starts to break down. And when that happens, things can come in inappropriately. For example, you could get bad guys in your bloodstream, you can get undigested food particles like gluten, for example. Your immune system starts to attack those things inappropriately, and it can ramp up the autoimmunity with your thyroid as well. And so it's really important to look at gut function. 80% of your immune system is in your gut. If we're talking about 80% of the people with hypothyroid have autoimmunity, then there's a huge connection to the gut, and we have to look at the gut function. The next pattern we're going to talk about is with the buses. Remember the thyroid binding globulin. So sometimes you can have too many buses, sometimes you can have too few buses. If you have too many buses, what's going to happen is all of the free T3 and the free T4 that's supposed to get off the bus and go to the cell and activate metabolism, well, they like the bus. So if there's a lot of buses, they're all going to get on the bus and they're going to stay in there. It's air conditioned, they got big screen TVs in there, it's great. So the free T3 and the free T4, if there's too many buses, want to stay on there, and then you have lower activation of your cell's metabolism. You end up with a hypothyroid state. So what causes that? One of the biggest causes is elevated estrogens. So how do you get elevated estrogens? Well, as females know, you're going to have elevated estrogens when you take things like birth control or hormone replacement therapy in menopause. But all of us, including men, can be exposed to elevated estrogens through things called xenoestrogens. These are estrogen mimickers that you are exposed to in your environment. So in things like plastics or cosmetics or even dairy products that have hormones that have been injected into the cows, that stuff gets into your system and can cause these types of patterns. The other one is where you have too few buses. This can be caused by high testosterone. And what happens with this is, if there's not enough buses, everybody gets off the buses and it supersaturates your cells with too much thyroid hormone. This can be caused in males also with hormone replacement therapy. So as males get older, testosterone levels go down. They want to replace that, so they take a hormone replacement, and that can cause this pattern. But in females, it can be metabolic syndrome. So things like high blood sugar, high triglycerides, insulin resistance, that can cause this particular pattern in females. At the very end of thyroid metabolism, we talked about how the thyroid hormone, the T3, binds to the cell, a cellular receptor, and it activates metabolism. We can have a situation where the cell becomes resistant and does not respond to the binding of the cell by the thyroid hormone, which means you could have everything else could be working just fine all along the process that we've talked about. When the T3 finally gets to the cell, nothing happens because there's resistance. What causes that? A couple of things we've talked about before already: high inflammation, high cortisol from stress. Both of those can cause this particular pattern. A new one, low vitamin A, can cause this problem as well. And also increased homocysteine. Now, homocysteine is an inflammatory marker that we find on blood. This can be elevated due to compromise with B12 physiology and also to a genetic defect called MTHFR, or methylene tetrahydrofolate reductase. This gene defect, it has a 30% prevalence in the entire population in the United States. But in my office, because everybody's coming in with chronic diseases, we see over 90% of people have this gene defect. So it's really important that we address this. When we have high homocysteine, it can also lead to things like heart disease, diabetes, focus and attention problems, and even dementia. Okay, of all of the different patterns that we've talked about, the most important one, as I hinted to earlier, is autoimmunity. Autoimmunity to your thyroid is where your immune system inappropriately attacks your thyroid gland. It's called Hashimoto's disease. It was discovered in 1912 by Dr. Hashimoto. So the question becomes, what causes your immune system to start to attack your thyroid gland? A couple of different things can trigger this. One would be vitamin D issues, so you either have low vitamin D, and I see this on almost all of my patients that we test. They have very low vitamin D levels. You can have a vitamin D genetic problem that can lead to that as well. Too much iodine can exacerbate autoimmunity, so you don't want to be taking iodine because 80 to 90% of people have Hashimoto's. Most of them don't even know it. Some of you are taking iodine. That can make things worse in regards to autoimmunity. Heavy metal exposure, estrogen dominance, which we talked about before, even if it's estrogen exposure from the environment. Pregnancy is huge. This is where you have fluctuations in your hormones. It's a natural part of the process, but it can trigger autoimmunity, and I hear over and over and over again from women, after my second child, everything went crazy, and it's been that way ever since. That's a very common thing that we hear. Insulin resistance, so this is blood sugar regulation issues, whether it's too high or too low or both can trigger autoimmunity. Gastrointestinal issues and even food sensitivities, as we talked about before, and that one's pretty huge for the autoimmunity as well. Again, just to reiterate, the number one cause of hypothyroidism in the United States is an autoimmune disease Hashimoto's disease. This is where your immune system is attacking your thyroid. It's not an actual problem with the thyroid gland. It's a problem with your immune system. And in the traditional medical model, they're not looking at that cause. Too often in the traditional medical standard of care for thyroid, most of these potential patterns of dysfunction are missed, as I just hinted at. That's probably why you're still having symptoms despite being told your labs are normal. There are just some labs that have not been run, and so no one's looking for these patterns. Let me once again encourage you that there is hope. I do look for all of those patterns. Chances are you have more than one, and we see that very commonly. No matter how many contributing factors you have causing your thyroid issues, I will be addressing all of them. It does you absolutely no good if we don't make sure we've covered all of our bases, so to speak. In making sure that I'm working on all of the areas of concern, I use functional neurology and functional medicine in the care of all of my patients. Functional just means that we're getting to and identifying and addressing the root causes of your issues, not just the symptoms. The way this is done is through proper and thorough testing. We start off with a comprehensive blood chemistry analysis. In this analysis, we are doing a full thyroid panel, including the antibodies. So I am testing the TSH, but I'm also going to look at 10 other markers, and I'm going to identify whether or not you have Hashimoto's, because that's very important. We talked about how blood sugar impacts thyroid. It's important that we look at your blood sugar. We're going to look for anemias. If you have an anemia, you're not getting any oxygen to your tissues, and if you're not getting oxygen to your cells, it doesn't matter what else we fix, you're not going to produce energy, and you're going to have a low metabolism. Infections can trigger autoimmunity, so we're going to look at white blood cell count to see if there's any infections. We're going to look at a bunch of different inflammatory markers because, as I mentioned, inflammation is a driver of all chronic diseases. There are over 70 different markers on my comprehensive blood chemistry analysis. This is where we start. And what we do is we look at it and interpret it differently than they do in the traditional medical model. So in the traditional medical model, they're looking at the lab ranges that are very wide, as I mentioned earlier. We're looking at the functional ranges. It allows me to see disease in process rather than wait until you fall over the cliff of disease, so to speak, and try to pull you back up. Once we do the initial testing with the blood work, then we can go on to more advanced testing based on what we found in the initial blood chemistry analysis. What we can do is look for immune panels. Once you have one autoimmune disease, in this case Hashimoto's, you're more than likely to have more than one autoimmune disease. In fact, 50% more likely. So we can look at a bunch of other tissues to see if they also are being destroyed by your immune system. It's very important to identify those. We're also going to look at your adrenal glands. Your adrenal glands regulate your sleep-wake cycle. Adrenal glands produce cortisol in relation to stress, as I mentioned, how that impacts thyroid hormone. And adrenals also help to regulate blood sugar, and we talked about how that impacts your thyroid. We're also going to look at hormones. An imbalance in hormones can impact your thyroid metabolism. So for men and postmenopausal women, we're going to look at hormones just one time because those hormones should be basically the same all the time. But for a cycling female, we're actually going to look at throughout the entire cycle what your hormone rhythm looks like. That's extremely important to do it that way. It's not really ever done that way in the medical model. We're going to look for chemical sensitivities. Chemicals that you're sensitive to can drive autoimmunity. So we're going to look at things that are commonly exposed to in the environment to see if you have antibodies to them. I talked a lot about food sensitivities. Food sensitivities are where you have an underlying physiological immune inflammatory response to foods that you're eating. You may not even have any gastrointestinal complaints, so you may not even think that, hey, I have a food sensitivity because you never have cramping or bloating, and that can be possible, and you can still have food sensitivities. We can test over 200 different foods to see which ones your body is causing an immune response to, and then we can create a specific dietary plan for you to address that. GI pathogens, I talked about how dysbiosis and infections and parasites can impact thyroid function, so it's important to look at that as well as leaky gut. So we want to make sure that your gut is intact and healthy so that it does not have an impact on your thyroid function. And we also do the genetic testing for the MTHFR that I mentioned that has a huge impact on thyroid function as well as function of a lot of other metabolic processes as well. So all that testing, what does it mean? What do we do with the results? What we do with the results is create a very specific care plan for you, and that is supported by dietary changes, lifestyle modifications, and nutritional supplements. And let me just briefly mention the nutritional supplements. These are very specific physician-grade supplements that are formulated to do exactly what we want them to do physiologically based on your test results. It's not something you can just go pick up off the drugstore shelf. They are very specifically formulated to do what we want them to do physiologically, to make you function better on the inside so you start feeling better on the outside. That's the functional medicine side of things. I also evaluate all of my patients from a neurological perspective as well because, as I mentioned, the first two steps of thyroid metabolism happen in the brain. If there are brain issues and we don't find them and fix them, then we'd be missing a huge piece of the puzzle. So we always do a functional neurological examination. And what that means is when you come in, I'm looking to see how is each part of your brain actually functioning. So we have you do different tasks that require proper activation of different parts of your brain. If you cannot do that task properly, then that part of your brain is not working well. And then in terms of rehabbing that part of your brain, we provide the three things that your brain needs in order to be healthy. Your brain needs oxygen, it needs nutrition, and it needs to be activated or stimulated. We have specific brain-based therapies that will activate or stimulate different parts of your brain that we'll use based on your specific testing. We also use exercise with oxygen therapy to work on the oxygen piece that helps your body to use oxygen more efficiently. And specifically for thyroid, we use low-level laser therapy directly on the thyroid itself because research has demonstrated that this actually helps to decrease the autoimmune attack on your thyroid and help boost thyroid hormone production. Another way that we evaluate neurologically is through QEEG, or quantitative electroencephalogram. What this does is it evaluates your brain's brain waves, the electrical activity coming out of your brain. And there are certain patterns that we can detect that correlate with certain symptoms. If we see that you have a pattern that correlates with a symptom that you also have, we know that there's a correlation between the dysfunction there. And then we can use a very specific therapy called neurofeedback to retrain that brainwave pattern so that it functions better and then the symptom goes away. It's a very, very effective form of therapy for the brain. Now that you have a great idea about what functional medicine and functional neurology are and how we use these tools to help patients like yourself to identify and properly address thyroid dysfunction so you can get your life back. So the question becomes, why doesn't your primary care doctor do this analysis? Well, if you remember, they are stuck inside this medical box. Everything that they do for thyroid is inside this box. So they test your TSH. If you're inside the range, great. If you're outside, you're on some medication until you get back inside. And so stuck inside this box, even if they know of other things, they're bound by the parameters of this box, which are defined by the insurance companies and the pharmaceutical companies. So again, when we step outside this box, even though we're getting fantastic results with patients, insurance companies typically do not cover the services that we offer. But as I mentioned, we have great options in terms of payment so that on any budget you can get the care that you need. What we do is put together very specific, individualized programs that consist of dietary and lifestyle changes, and these really are extremely, extremely important. They are specifically tailored and customized to you, but if you don't do these lifestyle changes and dietary recommendations, if you're not committed to doing that, I can't care more about you than you care about yourself, so this is a huge component. We also do nutritional supplements, as I mentioned, to help augment the physiology of your body. And we have at-home and in-office neurological therapies to help to rehab the brain, as I mentioned. All of these parts of your program are based specific on your test results. So even if you and the person coming in after you have the exact same symptoms, the therapies that we use could potentially be different based upon your testing. So we test, and then we actually retest to track your progress. So along the way, what's going to happen is we're going to look at a reevaluation period where we see how are you progressing in terms of not only your symptoms, but also the underlying function. So we redo blood work, we redo the functional neurological exam, we redo the QEEG. We want to see how the progress is going. Commitment is huge. If you're sick and tired of being sick and tired, then you're probably very committed to doing whatever you need to do to get your life in order. So the question becomes, how motivated are you actually? Think of it on a scale of 1 to 10. 1 is you're not really interested in doing anything for your health. That's probably not you because you wouldn't be watching this video. If you're an 8, 9, or 10, that means you're willing to do anything you need to do to get your life back, and that means you're going to be a very good fit for what we have to offer. So, as I finish up this video, you may be wondering, this was great, now what? Well, let me tell you what the next step is. If you've liked what you've heard and you want to know more about how I may be able to help you, then the next step is to schedule your free comprehensive thyroid consultation. As you have learned, what we do in our office through functional medicine and functional neurology is very different than the traditional medical model. It is different and it works. Let me share with you a couple of examples. A patient named Cheryl visited my office and she said to me literally, "I feel like I'm going to die." One of the biggest concerns that she had was that she was only sleeping literally 7 to 15 minutes a night. 7 to 15 minutes at a time, excuse me. And she would wake up and then she'd go back to sleep for 7 or 15 minutes, then she'd wake up and back and forth and back and forth. She was not being rested or restored or rejuvenated at night through sleep. Sleep is hugely important for overall health. And so she literally felt like she had been hit by a truck every day. And so what we did through the functional neurology and functional medicine, we identified why is she not being able to sleep. For her, it was a neurological issue. So we started some neurological rehab, and within just a couple of visits with neurofeedback, she was sleeping 3 to 4 hours at a time. This is a huge change for her. Not only did it change how she was sleeping and how she was able to repair at night, but it had a huge impact on her quality of life as well. The second person I want to share with you is a patient named Sharon. And Sharon had things like anxiety and depression associated with her chronic pain and other issues. And she was so depressed and had so much anxiety that when she went to bed at night, she would literally pray that she wouldn't wake up in the morning. And obviously that's no way to live. And so what we did for her was we identified what is driving this anxiety and depression. And so we did a genetic test to look for her MTHFR gene defect. We found that she had 2 bad genes. When we addressed that with specific nutritional supplementation, she had an immediate 80 to 90% improvement in those symptoms. And after that, she wasn't asking not to wake up anymore. She was thankful and very appreciative that she would wake up and have a new day. So if you're ready to get answers and solutions for your unresolved thyroid problems, the next step is to schedule a consultation. It's basically like an interview. I'm seeing if you're a good fit for me, and you're seeing if I'm a good fit for you. If we mutually determine that it's a fit to work together, and if I'm confident I can help you, then we'll lay out a plan, and that plan will start the evaluation process to determine what's causing your thyroid issues and exactly what steps we need to do to get you better. And by the way, during the consultation, I will also let you know if I don't think I can help your thyroid symptoms too. There is no pressure and no catch. If I can help you, we'll map out a plan for how. If I can't, then I'm happy to refer you to other possible avenues. So once again, give my office a call to schedule your free consultation. When you call, speak to one of my team members and they will get you booked in the schedule. Thank you for watching and I look forward to meeting you soon.